Safe sex practices among high school students help prevent pregnancies, sexually transmitted diseases and infections, and HIV. These practices include the use of condoms, birth control pills, and other contraceptives. Trends among high school students over the past 20 years indicate a decrease in safe sex practices, especially among ethnic and racial minorities. The purpose of the current study was to analyze data from the 2019 Youth Risk Behavior Survey and look at racial differences in safe sex practices among high school students in the United States. We hypothesized that ethnic and racial minority high school students will report higher percentages of not wearing a condom during their last sexual intercourse, as well as a higher percentages of not using other forms of birth control prior to their last sexual intercourse.
In this study, we looked at 5 specific questions from the 2019 Youth Risk Behavior Survey, which is part of the Youth Risk Behavior Surveillance System. Data is collected at the national level from designated middle and high schools. The first question we looked at was, did not use a condom during last sexual intercourse. It was found that 51.8% of Black students, 43.1% of Hispanic or Latino students, and 44.2% of white students reported that they had not used a condom during their last sexual intercourse. The second question we looked at was, did not use birth control pills before last sexual intercourse. We found that 87.1% of Black students, 84.6% of Hispanic or Latino students, and 70.9% of white students reported that they did not use birth control pills before their last sexual intercourse. The third question we looked at was, did not use an IUD or implant during last sexual intercourse. The results were that 97.6% of Black students, 98.5% of Hispanic or Latino students, and 93.5% of white students did not use an IUD or implant during their last sexual intercourse. The fourth question we looked at was, did not use any form of birth control before last sexual intercourse. The results were 80.3% of Black students, 81.8% of Hispanic or Latino students, and 60.5% of white students did not use any form of birth control before their last sexual intercourse. For the fifth and final question, we looked at did not use any pregnancy prevention method before their last sexual intercourse. We found that 23% of Black students, 13.3% of Hispanic or Latino students, and 8.4% of white students did not use any pregnancy prevention method before their last sexual intercourse.
Our findings reflect similarities to studies from the past 20 years. The results from the data analysis mostly support our hypothesis that high school students of minority races and ethnicities in the United States are less likely to practice safe sex. Possible explanations for minority students being less likely than white students to use forms of birth control include lack of knowledge, sexual education, and access to healthcare, as well as differing socioeconomic status, cultural norms, and utilization of forms not analyzed in this study, such as withdrawal. There has been research with findings contrary to ours. However, studies from the past 5 years have shown that safe sex practices have decreased all across races and genders, but more predominantly in students of racial and ethnic minorities. Further research needs to be done to investigate possible reasons for recent racial and ethnic differences in sexual behavior. Additionally, researchers should continue to analyze these trends in future youth risk behavior surveys.